in the fields of legal, health, financial, and home improvement. Enjoy being educated in such topics as personal injury law, community association law, family law, bankruptcy law, along with health show topics like pain management, men's health, and dental implants. Now, sit back and enjoy today's Ask the Experts with host Steve-O.
Hey, good afternoon. Welcome to another Ask the Experts. I'm Steve-O. And our first half hour, we have Dr. Lawrence Gorfine of Palm Beach Spine and Diagnostic Institute. Guess what we're going to be talking about today? Hey, Dr. Gorfine.
Good afternoon, Steve.
We had a great talk just off the air, and it's going to be an interesting show today. Sit back, light up that cigar, you two women, and we're going to hit subjects today you might never heard of, but they all have to do with some type of pain. But we're going to get rid of that for you. Dr. Gorfine is so good at that. So just sit back, relax, and first, tell everybody about your practice.
We do all kinds of sports medicine. Anyone who's in pain, whether it's from accidents, motor vehicle accidents, sports injuries, or just wear and tear and degenerative conditions that affect the body. We treat all of those, and we're very innovative, and we use the most new and modern techniques in treating the types of pain that people experience.
I didn't tell Dr. Gorfine this, but we had 2 emails that came in and said they hope you start talking about arthritis. So I take it they must have arthritis, which is very painful.
Right, and we're going to be actually speaking about that today because the topic is regenerative medicine. And one of the ways of treating arthritis is with regenerative medicine.
Now, you started your practice off as you were not a pain management company, but you sort of were because you started off where?
Well, I'm an anesthesiologist, board certified in anesthesia.
So you would do blocks and things like that?
Yes, we did all kinds of...
put people to sleep.
We wake them up and we take care of them during the most stressful time of their lives when they're having surgery. And we learned how to do regional blocks initially. What has happened is that these regional blocks, with the new technology we have today, we've been able to learn how to treat all kinds of different pain issues and many orthopedic issues that don't require surgery today that used to in the past.
Because you want to be kind of in that non-invasive area where you don't want to do surgery.
We don't want to do open surgery where we remove bone and other things, but we do, we call it minimally invasive procedures. Many times we can use high-tech devices through needles to accomplish these types of repair procedures to people who've had injuries.
Well, one of the first things we're going to talk about today is regenerative medicine, which I've never even heard of. So tell us about that first.
Well, this is really very exciting. We've learned that it's so much better for us to try to heal an injured or damaged part of our body rather than to replace it. Hip and knee replacements work perfectly fine, but our own natural parts are much better than any artificial parts that we have. So there's a major direction today in learning how to stimulate healing and repair of damaged tissues. With the technology that we have today and our ability to assay the chemicals in our body that turn on, regulate, and modulate the entire healing process, we're now learning how to do that using different kinds of medications, chemicals, and so on to stimulate this healing process.
So I've had a hip replacement. So if someone maybe is supposed to have surgery, shouldn't they come to you first just before they have that surgery, just to make sure that because you might have a way of healing them and they might not have to have the surgery?
That's absolutely correct. However, with that said, yes, we can avoid surgery or put off surgery for long periods of time, but the best thing to do is the first sign of arthritis in a joint are new techniques that stimulate healing and repair of those joints work best when we have something to work with. What that means is the first sign of some of the symptoms means you still have some good tissue there. You still have some good parts that we can regenerate and grow new tissue to repair those injuries. So the sooner that you come to us, the better it is and the more success we have, and the greater the possibility we can completely avoid surgery for you.
So, for example, with the hip, what are the signs that maybe I have a hip problem, so I don't have to wait too long before I could see you?
Well, what the first sign would be, obviously, would be some pain. It would be, on and off, some pain in the hip, some pain in your groin. Hip pain tends to radiate into the groin.
Did not know that.
And down into the thigh sometimes.
It does, believe me.
Right. Well, I'm sure before it got severe, you had occasional pain on and off, and then gradually over time it started to get worse and worse, and then you went to a doctor. What we're recommending is go to your doctor sooner. Go to someone such as myself who does these regenerative injections sooner. There's much greater chance that we can repair that problem before it gets severe.
That makes so much sense, because I waited because I was actually putting off the surgery. But instead, if I would have come to you, I might not even had to have the surgery.
Right. And that's true. Many times you'll go to an orthopedic doctor, he'll do some x-rays and say, well, you're not quite there yet, but in another year or so you might need it. That's the time to come to us.
Wow. And we're also going to talk today on stem cell, which I was pretty excited until we spoke this afternoon. Tell everybody about stem cell first.
Well, first of all, if you look up stem cells, the definition is non-differentiated. And a lot of people say, well, what does that mean? Well, what it means is a stem cell is a basic primary cell that can become different kinds of tissues, meaning it can become heart muscle, it can become regular muscle, it can become tendon, ligament, skin. So this is a cell that can be directed to become what it needs to be in the body. And what we're trying to learn today is how to turn those stem cells on to do what we want them to do.
Well, you said to me, you said it will happen eventually.
That's correct.
And I have never heard that, because we have shows around the country. We have clinics that do stem cell. And you've actually, and I loved your honesty, because you're the first one, because I haven't really heard that it's not completely one or even 90% or 80%. And, it is expensive.
Right.
So it was nice that you were upfront with me about it. And it's like anything else. It doesn't work for everybody. So some people it might work on. But I don't know if I want to hear might.
Well, first of all, healing is a complicated process. And healing is turned on by a variety of different chemicals. These are chemicals in our body. Our body turns on these chemicals. Some of the chemicals stimulate skin cells to grow. Some will stimulate muscle, tendon, ligaments, and so on. And and blood vessels, very important, because in healing tissue, we need a good blood flow for nutrients to keep those cells growing and keep the tissue growing and getting better, stronger, and more productive in whatever function they're supposed to undertake. The problem is we don't know the mechanism, and we don't know yet all of the chemicals that we need to stimulate and to get to do these things. So yes, stem cells are the basic cell. We have them in our own body. There are different kinds. There's the embryonic stem cell that you've probably heard of, that are from babies, newborns, placenta, and these are also non-differentiated and can grow into almost anything. We also have some in our body, the adult stem cells, and that's when we get a cut and when we get healing of that cut, it's our own internal adult stem cells that create that new tissue. And that's what we're basically starting to work on today, is to figure out how to get these cells turned on. One thing very important that we've learned is that platelets are very important in this process. Now, platelets are special kinds of blood cells within our bloodstream. We know that platelets are used in coagulation or forming a clot and stopping your blood from flowing once you get a cut. But what we've only realized over the last 20 or so years is that inside of those platelets are granules that contain numerous chemicals that turn on that healing process. So when you get a cut in your skin, you'll get a scab, and that scab will send chemicals down into where the cut is and stimulate that healing process. So that nice new tissue that forms and seals off the cut that you've had and makes your skin return to pretty much to normal later on, that's all turned on by the platelets. So what we're learning today is that if we add platelets to the stem cells, we get a much better response. But
is this an injection?
Okay, now let's say then that let's pick something that's easy, like your Achilles tendon in your heel.
Okay.
You know, you hear football players. Dan Marino had a tear to his Achilles tendon,
right,
for example. Now, if it's a complete tear, yes, we need a surgical repair. But if it's a partial tear, we can inject. We can take that same person's platelets. We take it out of their blood. We spin down the blood and we concentrate those platelets. We then inject the platelets along the Achilles tendon. Those platelets then stimulate heal and repair of the tendon.
Wow. How long does it take?
That's a good question. Healing is slow. Healing in orthopedics is very slow. If you have a fracture, you're 6 weeks in a cast,
right?
And then even then, your bone is better, but it's not ready for full action. So you have another couple of months before your bone is strong enough for sports and other activities. It's the same with Achilles tendons, with ligaments, and so on. Orthopedic healing is slow, so the healing process could be several months.
How many times would they have to come in?
Well, that depends.
I know everybody's different again.
It depends on the injury. Usually we'll do, with the platelets, we'll do 2 or sometimes even 3 times, maybe a month apart, to stimulate healing. Healing is a slow process, and part of the reason why sometimes areas of our body don't heal particularly well is that we don't have a lot of platelets in that area. So if we put some platelets in and then 3-4 weeks later we put some more in, and then again, if necessary, a third time, then we get a slow progressive healing where we get a good strong tissue that's been repaired, rather than just one time we might not get a full.
And platelets are what?
They're blood cells.
They're just blood cells.
They're your blood cells. And the beauty is very little side effect from them because they're our own blood cells, they're our own tissues.
So you literally draw blood, those are the platelets.
Yes.
And then the stem cell, where does it come in?
Well, again, we have our own stem cells in our own circulating in our own body.
Okay.
So what we're doing is we're turning on the entire healing process. Stem cells are a part of it. There are other factors that cause, as I mentioned, blood vessels to grow, different kinds of tissue to grow, different kinds of repair, and even it will attract the immune products that fight bacteria and make sure that the area stays clean and appropriate for healing.
So this would literally almost keep you from having surgery.
In many cases it can.
Wow.
Yes. And it stimulates healing.
That's amazing.
So, people, for example, another very common area that gets injured frequently is the shoulder, the rotator cuff.
Right.
And we've had very good results with platelets, and there's another thing that we're using a lot of too, and that's called prolotherapy,
which we're going to talk about next.
Yes. And those types of treatments and injections, specifically in the areas where the injuries have occurred, can stimulate healing and repair of that.
What about knees? There's you hear a lot of different, things, meniscus, you hear a lot of things. Same thing with the knee too? Yes.
Again, meniscus is a little bit difficult because there's not a really good blood flow to meniscus, and it's a little hard to stimulate healing, but we do get some major improvement in pain and functionality of the meniscus. Your cruciate ligaments and the other ligaments of the knee, we've had very good results with both prolotherapy and PRP injections.
Now explain this therapy now, this prolotherapy.
Well, interestingly, prolotherapy has been around a very long time.
I've never heard of it.
Most people haven't. It started off with a lot of.
Does it go by something else, Dr. Gorfine?
No. Well, I think around 70 years ago it was called sclerotherapy.
Okay. Got me on that one too.
Right. But what happened was there were a couple of political groups that were involved, and there was controversy initially with prolotherapy. Prolotherapy is simply a chemical stimulant that stimulates an irritation to the tissue. It's mild, and that turns on our natural healing process. There was a lot of controversy many, many years ago.
Because?
Different groups disagreed with each other,
okay.
and because of the controversy, insurance companies wouldn't pay for it, and it stayed relatively out of favor until about the early 1990s, when several physicians, particularly one or two of them in California, started doing some work with that and started writing papers in review articles about prolotherapy, and it became very popular starting around the 1990s.
Does insurance cover it now?
Some do. Some
Okay.
insurances do, but many still don't because, again...
I don't understand it.
And because of the controversy.
Okay.
They don't want to get involved in controversial issues.
So I know there's people out there going, so give us his phone number. Give everybody your phone number before we go to break.
Well, it's 561-649-8770.
And your website?
Careinjury.com, www.careinjury.com.
Okay, we're going to go to break. When we come back, I've got so many more questions for you. And I like to talk about side effects, too. We'll
Happy
be right
to do
back.
that.
God, I'm just...
When you're in pain, life seems to lose its colors. Whether you're suffering from neck and back pain, sports injuries, or injuries from automobile accidents, Palm Beach Spine and Diagnostic Institute can relieve your pain. The board-certified physicians at Palm Beach Spine and Diagnostic Institute are dedicated to treating your injury or condition and stopping your pain. What makes Palm Beach Spine and Diagnostic Institute so unique is their ability to avoid surgery by treating you with innovative and leading-edge, minimally invasive orthopedic techniques. Dr. Lawrence Gorfine treats herniated discs, neck and back pain, shoulder, hip, and knee injuries and conditions. Palm Beach Spine and Diagnostic Institute is considered state-of-the-art as it relates to pain, injuries, and chronic conditions. Don't put up with the pain anymore. Call Palm Beach Spine and Diagnostic Institute at 561-649-8770. That's 561-649-8770.
And we're back here. We've got about 12 minutes left. We're here with Dr. Lawrence Gorfine. He has his practice is the Palm Beach Spine and Diagnostic Institute, but it's not just back though. You do everything.
We do a lot of orthopedic injuries, shoulders,
knees, hips. I mean, so it's not just spine. And you just brought up something new again that I haven't heard of, but that has to do with the arch.
Well, that's all with prolotherapy. Prolotherapy is, as I started to mention before break, is a chemical stimulant that stimulates healing. It's a very mild chemical, and what it does is it just turns on the healing mechanism in the body. One area that we've been treating a lot of is the foot with plantar fasciitis. That's pretty common where people have severe heel pain. And it's been treated in the past with orthotics or support under your arch and so on. And what we've learned is that we can stimulate the ligaments in the foot to tighten to recreate a good amount of your arch and take the pressure off of the plantar fascia and off of your heel, and the pain goes away, and people can do normal activities from that point on.
If you haven't noticed yet, Dr. Gorfine does a lot of things that maybe other doctors don't touch, because I saw your practice. You've got state-of-the-art everything. I mean, this place is, when I pulled up, it was amazing. It's not just a little practice, but you showed me a lot of the diagnostic that you have there, and it's amazing.
Well, thank you for that. But what we just started off by reading a lot of the new technology and trying to implement some of the new things that we've learned into issues in pain and disease processes that already exist, just to try to think out of the box and create better ways of treating common issues like tennis elbow and plantar fasciitis and ankle and foot pain that people develop, as well as shoulder and joint pain, as you mentioned. We can.
So we had two people ask about arthritis. One actually said acute arthritis.
Well, again, it depends on the kind of arthritis that the person has, and that's something that we would do, would be to examine, diagnose, and determine exactly what kind of arthritis it is. Arthritis can be from infection, it can be from Lyme disease, it can be a whole bunch of different reasons for arthritis. However, if it's the wear and tear and the chronic rheumatoid arthritis that people suffer from, yes, we can do a lot to help. If it's not terribly severe,
and you catch it in time too.
Exactly, where the joint is already completely damaged. Once the joint is damaged, there's nothing really that we can do to regrow it.
And the expression bone on bone, like with knees, is it really actually bone on bone?
Yes, our joints are covered with a covering that protects one end of the bone from the other where the joints meet. That's called articular cartilage. It's a pad. It protects the bone. Now, we get wear and tear, and in injury, we can get actual tears and cuts to that articular cartilage or erosion of the cartilage. As long as we still have something to work with, we can regrow some of that cartilage material so that the bone doesn't start to rub against the bone. If we lose very large amounts of that cartilage and we in fact have, as you mentioned, bone on bone, then there's very little we can do. That's why we try to encourage people to come to us early on rather than after they have really severe problems.
Dr. Gorfa, I know that migraine headaches are very, very severe. Do you deal in that at all?
We deal in headaches if it's related to the neck and upper spine, but I don't actually do the migraines themselves. We stick more to the orthopedic causes of headache, which is very common, by the way.
Sports injuries.
Yes, sports injuries, and but headache is very common from neck pain.
What about auto accidents? Do you deal in auto accidents?
Yes, we see a lot of patients who've been in auto accidents, and we encourage them to come to us as quickly as possible. Again, also because for insurance purposes, because they have 14 days to come to us, or they lose a lot of insurance benefits.
So we're talking about all these different techniques, diagnostic. What about side effects? And I want to ask you, first of all, with the platelets or with stem cell, are there side effects also?
Well, just remember that with platelets, they're our own blood cells. So there are virtually no side effects.
Okay.
Two things that can occur. One is always the possibility of infection. So your doctor has to be very, very strict in sterile technique and be very careful to maintain sterile technique for procedures that we do in taking the platelets out and putting them back in again. With prolotherapy, the stimulant is extremely mild, and we really don't see any side effects. We do see a little bit of pain after some of these injections for a day or two, more so with platelets than with the prolotherapy. But again, it's self-limited. It only lasts for a day or two. And many patients say it's not much worse than the pain that they were having from that arthritic or torn rotator cuff or hip problem that they were experiencing.
And how many, like with the prototherapy, how many treatments are you looking at usually?
Well, it does
it depend on the area of the body that you're dealing with?
It does depend on the area and the severity of it. We tend to be very minimalistic, meaning we'll do 1 or 2 times, and then we'll have the patient come back, and we'll just reevaluate and see, do we need to do more? It's an ongoing, healing is an ongoing process. So we have you come back a week or 2 after we've done an injection of a prolotherapy or a platelet-rich plasma, and then we determine how is this healing process coming along. Now, the healing process takes a while.
Right.
It can be several months. So we'll kind of watch, and then from our own experience of healing, for example, I had a gentleman who had what's called tennis elbow,
Sure.
or
he's going to give us the big term now.
It's called lateral condylitis of the elbow, and I did a couple of injections. And he came back a couple of weeks later, wasn't doing really well. It was still kind of painful, but he got really busy at work. And he came back about 2 months later and said, I can't believe it. It's all gone.
Wow.
And it took about 6 or 7 weeks, and then it went away at about the 7th period of time.
Everybody's going to be different, I would think.
Again, but every injury is a little different. How
Right.
extensive was the injury? And everyone's healing capabilities and properties are a little bit different also.
Well, I always end the show with, why should I come to you?
Well,
He's so humble.
that's a hard question to answer. Because we care and we
Okay.
try very hard. And,
Not a bad answer.
And we try to make people better.
Hey, it doesn't get any better than that. Give everybody your phone number
561-649-8770.
and that great-looking website you have.
It's www.careinjury.com.
And you can actually see Dr. Gorfine's shows on his website. It's got a great webmaster on there. This is such a great subject because we have a little bit older audience, and some of them forget that they maybe shouldn't be playing tennis as much as they used to, and we just get the aches and pains.
We try to get them playing tennis. We really want to keep people
doing golf.
active. Golf, tennis. We keep people active and healthy, and they're happier that way, and it's good for them. They get good cardiovascular workouts. So we try to keep people as active as possible.
Well, again, the name of the practice is Palm Beach Spine and Diagnostic Institute. You're actually in Palm Beach,
West Palm Beach, right
off of 95.
Exactly.
Very easy to find. And listen, if you're in Fort Lauderdale, I'm going to tell you this right now, it is worth the trip. You do not have to find someone who's right in your backyard. Go to the best, and that's Dr. Gorfine.
Thank you.
You have a problem, he's gonna take care of you. And listen, when it comes to pain, I want someone who can take care of me. I don't want to be in that same pain a year later. I love what you do. It's amazing. And Dr. Gorfine will be back with us next month. No telling what topics we're going to be talking about. Thanks a lot for coming in, and I know people got a lot out of this. We'll see you next month.
Thank you very much.
We'll be right back.
When you're in pain, life seems to lose its colors. Whether you're suffering from neck and back pain, sports injuries, or injuries from automobile accidents, Palm Beach Spine and Diagnostic Institute can relieve your pain. The board-certified physicians at Palm Beach Spine and Diagnostic Institute are dedicated to treating your injury or condition and stopping your pain. What makes Palm Beach Spine and Diagnostic Institute so unique is their ability to avoid surgery by treating you with innovative and leading-edge, minimally invasive orthopedic techniques. Dr. Lawrence Gorfine treats herniated discs, neck and back pain, shoulder, hip, and knee injuries and conditions. Palm Beach Spine and Diagnostic Institute is considered state-of-the-art as it relates to pain, injuries, and chronic conditions. Don't put up with the pain anymore. Call Palm Beach Spine and Diagnostic Institute at 561-649-8770. That's 561-649-8770.
As an experienced personal injury attorney, Shane Farnsworth understands the key to success in your case. You are entitled to compensation for your injuries, medical bills, lost wages, and personal loss. Mr. Farnsworth will go to trial if you are not offered the fair settlement that you deserve. The law offices of Shane M. Farnsworth, VA, has established itself as one of the leading personal injury law firms in the South Florida area. They give all their personal injury clients a promise. If they don't recover monetary damages in your case, you will not pay any attorney's fees. Shane M. Farnsworth, VA, offers a free consultation to evaluate your legal case. If they take your case, they only get paid if they win. Whether you've been injured in a motor vehicle crash, slip and fall, workplace accident, or through the negligence of someone else, you need attorney Shane Farnsworth fighting on your side. Call now for a free consultation. That's 561-272-8337. You are listening to the Ask the Experts show with host Steve-O. We will be right back with more experts in the field of legal, health, financial, and home improvement. Join us every Thursday from 5 to 6 p.m. Now, get ready for more Ask the Experts.
Welcome back to more Ask the Experts. We're going from pain to maybe another kind of pain. We have personal injury attorney Shane Farnsworth with us. A little under the weather, so we're going to bear with you. And, this is what you do. You do injuries. Yep. From auto accidents to slips and falls to a lot of different kinds of accidents, but there's new people every week tuning into the show, and so introduce yourself. Tell people about your practice.
Okay, well, it's nice to be here, Steve. I wish I was feeling better, and hopefully my voice holds out for this. But
listen how hot it is.
Yeah, well, my office is in downtown Delray Beach. I'm at 70 Southeast 4th Avenue. If you're familiar with where they're building a new iPic theater, I'm directly across from that. So I've been there about 19 years. It's a good location right downtown, so you come enjoy the restaurants if you come to visit me. But, I have a small office. We give our clients personal attention and make sure that they're well taken care of.
Yeah, you're not a factory, are you?
No, we are not.
You know what I mean.
I know exactly what you mean. There's firms that are big and they don't give personal attention to their clients, and we end up sometimes with people that end up firing those attorneys that come to us because they're not getting the attention they deserve.
And I got to tell you something, and I don't care if we never do business with them. I have heard some really bad things on how they were treated, getting back with them. And I said factory, but that's kind of what some of them said to me. I felt like I was in a factory, and they were just trying to get me in and get me out. And I like that you are a solo practitioner. You have your own practice. And I want to say something else, because you're in Delray.
Yes.
But you know what? It doesn't matter if you live in Miami, if you live in Fort Lauderdale. You can handle anything. And don't always go to whoever the person is in your area. You want to go to someone good. And Shane, I've talked to so many people who said, well, some people even tried to handle it themselves, which was the worst thing they could do, because these insurance companies are very good at what they do.
They are. That's what they do for a living, and we've talked about it before. They make money by collecting premiums, not by paying claims. So oftentimes, if you're not represented or represented well, you're probably likely to be taken advantage of.
God, one of our friends, we just found out that they were on the phone with him after his auto accident the next day, offering a settlement. The next day.
Yes, that can happen.
Hoping you wouldn't hire someone like you.
Yeah, I've had clients that they've, generally speaking, insurance companies, they want to spend as little as possible. So
yes.
If they can get a hold of you and get you believing that, this is a fair settlement without you checking with anybody, you may shoot yourself in the foot.
And I think something I've learned from you is if you have a wreck, don't wait a week or two and find out some pain comes up. They should get a hold of you right away.
That is correct.
Waiting is not good.
Yeah, and one of the things we're going to be discussing today, our topic's going to be sort of the Florida PIP statute. And
now, what is it? I saw it on our questions today. What is that? I've never heard of that before.
Florida is a no-fault state. You've probably heard that. So you're required to have two coverages in your policy. You're required to have PIP, which is personal injury protection, and also property damage. PIP pays for your injuries if you're injured in an automobile accident. Basically, you're buying $10,000 worth of insurance that if you're injured in an automobile accident, that's your primary coverage. It's required, like I said, by the state. If you have an insurance policy, you have to have PIP.
Okay. Somebody told me the other day, it was actually a question, what do you do if you're in an accident with someone who doesn't have insurance? Is there anything you can do?
Well,
you meaning you, not them.
Yeah, well, it depends on, are you asking me in regards to the PIP statute?
Yes.
Okay. Well, if you get into an accident with somebody who doesn't have insurance, that's not going to affect you because we are a no-fault state. So regardless of who causes the accident, your PIP gets paid through your coverage. Now, that could be an issue if you don't own a vehicle, so you don't have PIP coverage, and you get into an accident and you're driving with somebody who doesn't have insurance. Because what happens is, if you own a vehicle, they go through yours, then they look to see if you have a resident relative who has a vehicle, and then you would use their PIP coverage. If not, then you would use the host vehicle. So if your friend is driving around without insurance and you don't have a car and you don't live with a resident relative and you get into an accident, you're probably not going to have PIP afforded to you unless you can get it through the policy of the other car.
So if somebody hits you, and so it's not your fault, but but in Florida it's no fault, so your insurance has to pay for it.
Yes, I always use this example when people come in.
So does my insurance go up if it was someone else's fault?
If it's someone else's fault, your insurance shouldn't go up.
Okay.
It shouldn't go up because of PIP. But I always tell people, the way that our insurance works here in Florida, you can be sitting at a stoplight minding your own business, and the guy behind you is talking on his cell phone, going 40 miles an hour, and doesn't see the red light and slams into you. Regardless of that fact, the first $10,000 of your medical bills will be paid by your PIP coverage.
Okay. Well, why do people need this coverage?
First of all, it's required by the state. So
That's one good
if you're
reason.
if you're driving on the road, you're required to have it. It's also helpful. Unfortunately, there's a lot of people who don't have health insurance, and that's sort of the thought process when Florida instituted this process. They wanted people to have some sort of coverage if they were involved in an automobile
What
accident.
if you have health insurance, though?
Well, that's good if you have health insurance, but because we are a no-fault state, your PIP coverage is your primary coverage. So
Okay.
That's important to know, because I always tell people, if you get into an accident, you go to the hospital and you give them your Blue Cross Blue Shield card, and you don't give them your automobile information, the hospital is going to bill Blue Cross Blue Shield, and Blue Cross Blue Shield is going to reject the bill and say, this is an auto accident, you need to go through the auto insurance, they're the primary coverage. Now, with PIP, you can use your health insurance as a secondary coverage.
Okay.
Because PIP doesn't actually pay 100% of the bill. It pays 80% of the
So
bill.
your health insurance might pick up the rest.
It could, yes.
Okay.
Generally, what would happen is, say you get into an accident, just to make the math easy for myself, the doctor bill is $125. Your PIP carrier determines $100 is the reasonable amount. That's what they agree to pay. So they would pay $80, and there would be a $20 copay. That if you had health insurance, you could use that as a secondary and bill it to your health insurance. If you don't have health insurance, generally what would happen is either you would pay that as you go along, or in a lot of cases, doctors will use what's called a letter of protection. And basically what that means is they're agreeing to get paid out of the settlement at the end of the case, and that way you don't have to pay that 20% copay as you're going through the treatment.
I know trucks and motorcycles are basically the same when it comes to insurance as automobile, but what about boats? I had someone ask me if you handle boat injuries, boating accidents.
Yes, we do handle boating injuries. We don't get a lot of those, but yeah, we do.
You would
handle,
think, though,
yeah.
down here that you would, but so does it work the same as, do you have to have separate insurance for a boat?
Yes.
Oh, you do?
Your boat has to be, yeah. Now, talking about motorcycles, going back to the PIP, PIP's required if you have a four-wheeled vehicle and that's registered in the state of Florida. So you don't necessarily have PIP
So that
for a
motorcycles
motorcycle.
aren't covered.
Correct, yes.
So is that a separate insurance?
You would probably have to buy that separately from the insurance carrier.
Well, we do, and please feel free to write us at AskTheExperts on Twitter. So we've been getting a lot of questions, and I actually had 3 people that wanted to know if you handle boat injuries, and one of them had seen an attorney, wasn't happy. I'm sure you get these, and they come to you for second opinions.
Yes, that does occur. Ethically, if somebody's represented by counsel, we're not supposed to be giving them legal advice.
Okay.
But if somebody's not happy with their counsel and they come in,
I think this is what it sounded like.
Yeah.
Somebody was not happy at all with their counsel.
yeah, so generally if that happens, they would come in, and if they felt more comfortable with us, they would make the decision to terminate the representation of the other attorney, and then they would sign a retainer agreement with us.
Shane, is there anything you could do, someone who, because there are people I know that try to settle this themselves. My son lives in Dallas, and he has told me stories, including himself. Can you do anything for those people if they've already done a settlement?
It depends. Sometimes you can get that vacated and you can go back, but it's why make the problem for yourself?
Yeah,
just do it right from the beginning.
The first time. You're right.
Yeah,
but there's people that I'm going to save some money, but I don't think people understand how you charge though.
Yeah, we use a contingency fee agreement. It's governed by the Florida bar, so
no money down.
Yeah, if we don't collect any money, we don't get paid anything, and the money comes from the settlement. So you don't pay any attorney's fees unless we recover, and we advance any costs that are needed, and we get those back at the end if we recover money.
So if someone's in a major automobile accident, and I go every morning to Miami down the Palmetto, and there's always major accidents. People are horrible drivers there. So if someone's in a major and they're in the hospital, can't go to work, what can you do for them?
Well, that's our PIP actually does cover lost wages. They pay at 60%, so it's not necessarily the greatest, but if you're out of work for a long time, you can use that 60% of the lost wages up to the $10,000 limit. So, if you have damages above and beyond that, then you can claim those.
Get paid? I mean, if you got major injuries, you're talking big hospital bills.
Yes, generally speaking, they'll bill the PIP, and if the PIP gets exhausted, at that point, it depends on whether or not you have health insurance. If you have health insurance, that would generally be your secondary coverage. If you don't have health insurance, you're treated as a private pay person, and you're going to be paying way more than the insured person, on the bills. Reason being, the insurance company, say Blue Cross Blue Shield, they'll make an agreement with the hospital that for a certain procedure, they're willing to pay $200 for it. The hospital may bill $600 for it, but they have a contract with Blue Cross Blue Shield where they get paid $200. If you don't have insurance, you're going to be getting billed at that $600.
In this PIP coverage, does it only apply if you're injured in a car?
No, it also applies. You have to be injured by a motor vehicle, but it also applies if you're a pedestrian, bicyclist. It also applies if
truck.
If your kids are on a school bus, your PIP will apply if they're injured on a school bus. Yeah.
Now, and we're talking about auto accidents, but some of the questions we got again are about slips and falls, and they should contact you. And one of them said it was actually at Publix.
Mm-hmm.
They should contact you right away. They shouldn't wait if they're not injured or not, because you never know, right?
Yeah, I encourage you, even if you're, don't feel that badly, get to the doctor and get checked out, because things develop.
Right.
And, you want to get treatment as soon as possible, so that way, if you're injured in the slip and fall, the doctor is able to correlate that injury back to, the accident.
Where are most slip and fall cases?
They happen everywhere. There's all kinds of different things.
But are they grocery stores or restaurants or
grocery stores, restaurants? Sometimes people are on a walkway. They walk into a medical building. It could happen anywhere. There's different things. A lot of times in restaurants and grocery stores, somebody spills something on the floor, and that's how it happens. But people can have uneven walkways. Steps that aren't properly maintained, and those are also slip and fall, trip and fall hazards.
Well, we're going to go to break. We're here with attorney Shane. And Shane, give everybody your phone number.
Okay, my phone number is 561-272-8337.
And your website?
My website is ShaneMFarnsworth.com.
Farnsworth is just like it sounds. We're going to go to break. When we come back, I've got so many more questions for you. You're doing good for not feeling well today.
Thank you.
We'll be right back.
As an experienced personal injury attorney, Shane Farnsworth understands the key to success in your case. You are entitled to compensation for your injuries, medical bills, lost wages, and personal loss. Mr. Farnsworth will go to trial if you are not offered the fair settlement that you deserve. The law offices of Shane M. Farnsworth, VA, has established itself as one of the leading personal injury law firms in the South Florida area. They give all their personal injury clients a promise. If they don't recover monetary damages in your case, you will not pay any attorney's fees. Shane M. Farnsworth, VA, offers a free consultation to evaluate your legal case. If they take your case, they only get paid if they win. Whether you've been injured in a motor vehicle crash, slip and fall, workplace accident, or through the negligence of someone else, you need attorney Shane Farnsworth fighting on your side. Call now for a free consultation. That's 561-272-8337.
We're back. We're with the final 15 minutes of Ask the Experts. We're here every Thursday from 5 to 6 during drive time. We have with us, and he's with us every month, attorney Shane Farnsworth. I keep thinking of that movie every time I say your last name. There was a movie that a guy played football, pro football. Anyhow, we're talking about this coverage, especially PIP. What exactly is an emergency medical condition, or what is EMC?
Well, before I answer that, let me back up a little bit because this is important information to know. A few years ago, they changed the PIP statute. It used to be that if you got injured in an accident, you had essentially unlimited time to go to the doctor and use your PIP benefits if it was an injury from the accident. Now, waiting a long time, as we always discuss, isn't a good idea, but they changed the law a few years ago, and now you have to treat within 14 days of the accident, otherwise you won't get PIP coverage.
Really?
Yes, so that's important. Now, the next thing is they also changed, you pay for $10,000 in PIP coverage. They changed it now that unless you're determined to have an emergency medical condition, the insurance company can cut off your benefits at $2,500, even though you're paying for $10,000 in coverage. So you have to be found to have an emergency medical condition in order
What
to
are the
access.
guidelines?
Basically, you have to have a licensed physician, dentist, physician assistant, or a advanced registered nurse practitioner has to make the determination. I was going to read the definition to you from the statute.
I guess that's what EMC stands for.
Yeah, well, the definition is a little convoluted.
Okay.
So I was going to read it to you. An EMC is defined by the PIP statute as a medical condition manifesting itself by acute symptoms of sufficient severity, which may include severe pain such as the absence of immediate attention would be reasonably expected to result in 1, serious jeopardy to the patient's health, 2, serious impairment to the bodily function, or 3, serious dysfunction to any bodily organ or part. So they leave that up to the licensed physicians to make that determination.
Why did they change that law?
Essentially, the insurance companies have good
They're
lobbyists.
always protecting them. Yes, good lobbyists. I can understand that.
I mean, think about it. You're paying for $10,000 in coverage, and you have to jump through this hoop in order to access it. Otherwise, they only have to pay
So the
$2,500.
doctor determines on the EMC.
It has to be a licensed physician, like I said, or a dentist could also do it. Sometimes people get in accidents and have dental problems. It could be a physician assistant or an advanced registered nurse practitioner. So you can treat with a chiropractor. Now, in terms of PIP benefits, PIP will pay for treatment with an MD or a DO, or a chiropractor, or a hospital, EMS. It pays for those things.
Right.
It doesn't pay. It used to, but it no longer pays for a massage therapist or an acupuncturist, even if an MD is overseeing that treatment. So, it's important to know that and to understand.
Where's the ambulance coverage come in?
Well, that's the EMS.
That's the EMS. Okay.
Yeah.
So, because those have gotten just crazy how expensive they are.
Yeah, they run generally around $750 for a trip.
Yeah, when did that happen? What happened to the days when I get a bill for $75? That doesn't happen anymore.
Yeah, you're definitely not going to get a bill for $75.
Wow, and that's just even if they just pick you up. If we're talking auto accident, whiplash, is that still a terminology, whiplash?
People do use that. I generally don't. People generally call it soft tissue injuries nowadays. But whiplash is, it's an older term.
Do you have to go to court much? So we're talking litigation now.
It depends on how the insurance company is treating the client. If they're being fair, a lot of times you're able to resolve the case without litigation. In the event where they're not being fair, you have to file suit and pursue the claim as best you can.
But you try to work it out. You don't really want to go to court if you don't have to.
And we're not afraid to go to court if we have to, but if, like I said, if you're able to work out a reasonable resolution of the case, sometimes that makes more sense than the uncertainty and cost of litigation.
You know what I always tell people, Shane, because this is what you do. You're a personal injury attorney. I don't see anywhere where you do bankruptcy or criminal law. You're a personal injury attorney. This is what you do. And I got to tell you, I really respect you for that, because this is your area of expertise. Instead of seeing these shingles that the people do estate planning, they do criminal law, and I don't see how they keep up with it all. But this is all you do is strictly personal injury. Do you get into any work injuries at all?
I don't do workers' comp.
Okay.
If we have somebody who's injured while they're working, we can represent them in the third-party claim for the personal injuries. But generally speaking, we would help them find a workers' comp attorney to handle that portion of the claim.
Is any work-related injury always going to be workers' comp?
Yes, generally,
Okay.
yeah.
So, because I see some law firms, they put workers' comp law, and some go work-related. I didn't know if that was a different type.
No, I mean, for example, if you're working in the warehouse and the forklift operator is not paying attention, he backs over your foot, that would be covered by workers' comp. If you're a delivery driver and you're driving your delivery van down the road and somebody slams into you and they run the light, that's also going to be covered by workers' comp if you're in the course of your employment.
Does PIP, now, they will pay for all medical bills up to the coverage limit.
Well, not exactly. We
Okay.
talked about this a little bit earlier. They pay 80% of Medicare Part B, which is a very confusing way to explain it. But like I said, if they determine that, if the doctor billed $125, they determine $100 is the allowable amount, they would pay $80. So that $20, like I said, could either be billed to your health insurance if he has
Right.
as a secondary. It could be a letter of protection to the doctor. There's also another thing that comes up is people who elect PIP deductibles. I tell people, when you speak to your insurance agent, try to get the best coverage you can. I mean, usually the agents are trying to sell the policy, so if they're trying to give you the least expensive price, but if you get the least expensive insurance and then you need it and it's not worth anything, then you've wasted your money. So if they have PIP deductibles of either $500 or $1,000, I recommend, if you can pay for it, avoid the deductible, and then your benefits start. Otherwise, you're going to be responsible for that portion of the deductible before your PIP benefits actually kick in.
Well, I cannot believe there's so much to know about the PIP insurance, things I've never even heard of before. Tell people why they should come to you.
Well, our office, like I said, it's a small office. It's
And
myself.
you do dog
and
bites, too. Is that right?
Yes, we do.
Because we hear about, especially the pit bulls, all the time with dog bites, and I don't think people know that they could go to an attorney like yourself.
Yes, absolutely. Yep. But yeah, our office, I have two paralegals and myself. If you come to us, you're going to get personal attention. If you call us before noon, you'll be called back that day. If you call us sometimes after lunch, it may be the next day, but generally we'll get back to you that afternoon. And we're available. If you call, you'll speak to us. My paralegals are generally able to handle most questions, but sometimes some people, they feel they need to speak to the attorney. I'm available to speak to you. Sometimes people come to me and they say, I've been with this law firm. They've been working on my case for 6 months, and I've never met the attorney. I don't know any of the attorneys. I met with the secretary. They signed me up, and that's it. And that's not how we work. You're going to know my office, and we're there to help you, and you'll get in touch with us, and we'll do a good job for you.
So people always want to know, when are they going to get their money? I bet that's got to be a big question. But you know what? You know what the case is worth. You've seen so many cases. You basically, when you get a case, you know about what you're going to be able to get. And I'm sure you've probably worked with a lot of the insurance companies. So I would think that is, if it's taking longer to get the money, it's because there's more there.
Well, every case is different, but essentially, most of the time, until you're done treating, we're not actually sending a demand. So if you're treating for a long period of time, it may take longer than somebody who's not as seriously injured who is done treating sooner. So every case is unique. There isn't any specific answer to that. As people ask me all the time, how long is my case going to take? A lot of that has to do with your medical care and your medical treatment, and your doctors are the ones steering the ship on that, and they're the ones trying to get you better. When you reach maximum medical improvement, they do the final evaluation, give you your impairment rating, and that's when we send our demand off.
I learned, Shane, a long time ago, I had a case against an airlines, and like an idiot, I was just trying to, they'd tell you to call them back, and I'd call them back. And I learned they do not take you serious until you do have an attorney. Because they were saying to me, I said, what's the rush? You don't have this is what someone told me. They said, why do they have to rush? They're dealing with you. And when this is in Denver, when I hired an attorney, things start rolling because now they know that, that this would go to litigation. So it's important to hire somebody right away.
Yeah, especially companies, they talk about, they want to save money. So if they're threatened with litigation, they're more likely to settle your claim or get it taken care of to try to avoid those kinds of costs.
Well, you've done a great job today because I know you're not feeling well. And PIP, I'm sure people learned today, they never knew things I'd never known. Give everybody your phone number one more time and your website.
Phone number is 561-272-8337, and the website is shanemfarnsworth.com.
Write that down. Maybe you might have a friend or relative who's in an automobile accident. This is really a good guy. Shane will be back with us next month, and we'll be back next week with more Ask the Experts. Everybody have a wonderful week.
Thanks for listening to the Ask the Experts show, featuring interviews with local experts in the fields of legal, health, financial, and home improvement. Call our office at 888-574-6999 to become one of our experts on the show. And tune in again next week for more Ask the Experts with Steve-O. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.